Hi, my name is Shalan Shah, and I'm a radiation oncologist practicing in Houston, Texas. The following is intended for education only and is not meant to be medical advice. For more advice specific to you or your condition, please do reach out to your primary care physician. There are a number of different types of radiation therapy that radiation oncologists have in their arsenal to treat a variety of different conditions. This right here is a linear accelerator for photons and electrons. On the left is an orthovoltage machine for lower energy photons, and the right is a proton therapy gantry. When treating Dupuytrens disease, the most common type of radiation used are electrons and low energy photons called orthovoltage because the area we want to target is very superficial. High energy photons or proton therapy is generally reserved for treating tumors or other conditions deeper in the body, like brain cancer or lung cancer. What we generally want to focus on when treating Dupuytrens is the connective tissues that lie in front of the bones but underneath the skin. Therefore, we need a superficial type of radiation that doesn't necessarily penetrate through the entire hand and body. Electron therapy enters into the body, reaches a maximum dosage at a certain depth, and then quickly falls off to zero dose. How deep the electrons goes depends on the energy of the beam selected. Similarly, orthovoltage beams start with a higher skin dose and then slowly fall off after 4 to 6 centimeters. When compared to electron beams, orthovoltage beams have a slightly higher skin dose, but also result in a slightly higher dose to the bones at depth. To compensate for the slightly lower skin dose on entry with electrons, physicians will use a tissue equivalent material, which we call bolus, on top of the hand. This way, the electrons will build up to full dose by the time they hit the skin. Using a CT simulation scan, we can figure out how deep our target is and then calculate how thick of a bolus material we need, as well as what type of energy we actually need to treat the areas we want to target. Our team can then also use blocks or shields to help shape where these radiation fields are going laterally. In contrast, high-dose photons and protons have a much deeper penetration. In the end, the radiation oncologist and their physics team will design a custom treatment plan for each patient to maximize the chances of successful treatment. I hope you found this presentation useful. If you have any more questions, please feel free to email me at shalanshahmd@gmail.com.